Welcome to mindyourhealthcast.com. I know you've been sitting anxiously awaiting the next broadcast, so here we go. I have had a request for a broadcast on hypertension, and so I have brought together all of my resources on the subject of hypertension. Not too much different than I've been doing over the years as far as working with patients with hypertension. There is a tremendous amount of variables involved, but first of all, I think that it's important that you know something about the body and how the body works in relation to cardiovascular function, including the pressure on the arterial and heart muscle walls. So, we're calling this hypertension, hype, and fact. Now, of course, you've heard all kinds of things. For example, it's classified as a disease. And again, as I've mentioned on many occasions, in the modern world of medicine, one takes a group of symptoms, sometimes one, sometimes several, groups them together and gives it a name and a classification, and hence it becomes a disease. And therefore, you don't treat the person, you treat the disease. One of the problems when there is malfunction in the body of some sort is that almost always there's a lot of things going on that are unique to that person that brings out symptoms to the point that it could be problematic. And pretty much in all cases, the symptoms are indicative of the malfunction, and the malfunction is the problem, not the name of the symptom. So, as always in true natural medicine, now I say true natural medicine because there are a lot of practitioners who either have gone directly into natural medicine or who have been practicing under traditional medicine, but for whatever reason, whether it's they really want to help people and are looking for the best ways to do it, or whether the whole idea of natural medicine has become trendy, and hence they thought they would start using it as a drawing card to get people in. My experience is, after having worked with a lot of MDs, DOs, PAs, and whatever, that even with the best of intentions, so many times they don't have a real understanding of causality versus symptomatology. And hence the therapy is more based on managing the symptoms in a more natural way than managing the symptoms with the more powerful pharmacology. Now, I would say more often than not, if you want to get in competition with pharmacology, meaning the pharmaceutical industry, you're going to need some pretty powerful concentrated natural products to compete with the action of those very powerful chemicals that have tremendous inhibitory effects in the body. Remember, you can make pretty potent poisons by concentrating even an herb. And the pharmaceuticals, it basically starts out as a molecule that the body's never been used to, and hence can have tremendously powerful effects in terms of turning off or blocking symptoms. And I keep saying, and I guess in some cases it clicks with people, sometimes it doesn't, that the actual symptom is in no way the problem. The symptom is more often an attempt by the body to somehow handle it, and sometimes because it has blocked up something in the body and therefore the body is trying to work around it, that these symptoms come about. And with the pharmaceutical drug, they're very powerful. They're synthesized, and it's an artificial molecule in a sense, meaning it does not exist naturally in nature, which is also why over time they fall apart, as opposed to an herb or homeopathic pretty much lasting indefinitely. Synthetic molecules tend to run down energetically and fall apart. The molecules do. So that's why they must have an expiration date, whereas homeopathics traditionally from the beginning were never required by the FDA to have an expiration date because they don't really expire. So anyhow, it's hard for those people who are trained at immediately jumping in and managing a symptom to realize that if you're really going to make the person healthier, that you have to find out what is going on that is causing the body to generate the symptom. And for some reason that seems to be hard to grasp because, as I say, I read some articles by some very sincere doctors who have decided that they weren't getting people well with regular medicine, and so they chose to go a different direction, but they still are hung up on this medical model that you must control the symptom. And if the symptom is controlled, the patient certainly feels better, and if the patient feels better, the doctor feels better, but are you going to want to take that for the rest of your life, or are you actually going to get the person well? Okay, so to be able to get to the core of problems, then you must understand how the body works. So now you get into physiology. And if you understand the physiology of the body, therein lies the key to the corrective action to help the body correct itself so that the problem is taken care of. Now, it always, of course, sounds simpler to talk about than it is to do, because many times there are multiple issues going on, or what the German doctors I studied with call causal chains. Now what that means is that if this is wrong, then this leads to this being wrong, and then this leads to this being wrong, because everything in the body is interconnected. So you can't separate this without affecting this. So you have to deal with the real issue. And so it's hard when you really want to get the person well. You have to move them backward through that sequence of disturbance. Because if A shuts down, which causes B to shut down, which causes C to shut down, it's not that simple just to go back to A and say, okay, we're going to correct that and it'll all be corrected, because what I have found, and I think this is pretty prevalent out of people who understand real natural medicine, is that you have to start with this shutdown and kind of get it going and get this going to get back to this one, and then you can correct this one, and then the whole thing is operational. But I've tried it all the different ways from the beginning and found that moving backward from where you are now, and now with the electronic measuring equipment, that's the way it works. It will bring up the more current stuff first, and as you correct that, then the body can move backward, because otherwise it's like trying to push the whole train from way back. It just doesn't work very well. So if you move this out of the way, then this out of the way, then you can go back to that. So if you understand that principle, then it makes a lot of sense, and you can actually get people well. And I have gotten people well that I may never see again at all, or I might see 10 years from now, 15 years from now. And in a few cases, people will be so concerned because they were so sick that they want to come back every 6 months or a year just to be checked to keep from getting into the same problem they had originally. Okay, so hypertension, hype in fact, is what we're talking about, and we need to understand how the body regulates itself, as I said, which is physiology, and you don't just want to know where the pieces are, you want to know how the pieces work and how the pieces work in conjunction with all the rest of the body, And when you really get into it, you see how it's such a tight-knit whole, whereas all the different parts contribute and are interactive with all the other parts. So you can't do it very well just by considering the one area. Now, if you're going to reverse, you may talk about an area, and with my patients I talk about sometimes, well, the liver is not operating correctly, and then they'll say, well, gee, I had a blood test, the doctor said my liver's fine. Well, the blood test said there were no elevated enzymes, which are an indication of destruction of liver cells. Now, there's a difference between the liver being destroyed and the liver being hypofunctional, and generally speaking, medicine does not test for function, they test for destruction or pathology, because that's their game, is pathology. That's why very little has been done over the years for prevention, even though sometimes they use the term. The prevention in the way in which they use it doesn't end up being very preventative, because in a lot of cases the person still is wiped out by the problem because it has not been corrected. Now, what we're talking about is regulation of the body. And you cannot understand hypertension, or nor are you ever going to correct it, without understanding how the body regulates itself. It's interesting because, again, as I said, everything is interconnected. Even the Chinese understood that 5,000 years ago. Actually, it probably was longer, but we have written records going back 5,000 years indicating that they understood the interaction of everything in the body, which is also, they recognize that when you get sick or something out of balance and you don't correct that, it goes deeper and deeper and deeper until you have very serious, life-threatening problems. And so that was their practice, of course. As I've said before, you go to them, they check you out, they correct things now so that it never gets down to that deep, serious problem. Now, if you really look at the way medicine is practiced today, what they do is keep you ignorant of the symptoms of an invading problem that's going deeper and deeper. You're ignorant of the fact that if they wipe out the symptoms, you're not well, you've only turned off the alarm system. And that's kind of hard, and that's what happens with hypertensive treatment. Now, I have to say from the beginning, the numbers don't jive. If all of these therapies for cardiovascular, cholesterol, and that's all one big package, if those therapies are successful, why is cardiovascular death still the leading cause of death? Something is wrong, because there's more tons of drugs prescribed today than ever. And you know, it's strange, because when I was young, I always keep going back because, you know, I'm kind of an observer of people and of events and things. And when I look back, hardly anyone went to a doctor. Hypertension was pretty much unheard of. Cardiovascular disease was almost unheard of. And deaths by it were almost unheard of. And as I've watched the progression of modern society and modern medicine, what I've seen is that people are getting sicker with more serious problems and more deaths than ever, whether it be cancer or cardiovascular problems, the two top causes of death. And number three, which of course is never on the list, is death by adverse drug responses or reactions, ADRs. That has to be number three if you look at the numbers. But of course it never even gets on the list, because that wouldn't look so good. So at any rate, I remember that all this stuff wasn't a problem. And I've mentioned before, the little town I lived in, I think I knew one person with a cardiovascular problem, and that person had that from birth. They were born with a defect, a genetic defect. So, now we have this rising problem, and it's getting worse and worse, and we're treating more and more. Billions and then finally trillions of dollars are being spent, and I keep asking the question, are we healthier? And of course the answer is absolutely not. We're not healthier at all. So something is wrong, and if you're paying attention, you, at least I would think, would want to ask, what's happening here? Something isn't right. So let's talk about the body a little bit and hypertension. So I take the time to try to put all this stuff in perspective rather than just throw this out and this out. I want you to see the bigger picture, because then it begins to make more sense if you can see things in context as opposed to just as throwing out a bunch of facts. Medicine is really bad about numbers. We're going to treat numbers. Now, I have to say, when I first studied medicine many, many years ago, right after the ARC, people, when they checked their blood pressure, if you did go into a doctor's office, which was not very frequent, they would check your blood pressure because they were trained to do a whole regimen of a physical exam, which isn't done so much anymore. And that was one. They would take your blood pressure. And I remember that around 70 to 80, 85 was considered good for the diastolic, or the lower number. And the upper number, it was always considered to be 100 plus the age of the person. So if you were 20 years old, then the upper number would be 120, and the lower number would be 75 to 85, somewhere in that range. More often it was more toward the 75 than the 85. But we were living in a different period of time. And a lot of things have happened since then that have contributed to the issue. And so we're going to talk about those, because if you're really going to deal with hypertension, the secret isn't finding a drug that will relax the arteries so that they are not so tensive. Because that hasn't really solved the problem. There was something going on in the person that caused that. And to be able to turn that signal off, you have to use some type of a chemical intervention. If you're not correcting the problem, you're going to have a chemical intervention that's going to interfere with the signal to contract the vessel. And hence what's called a hypertensive drug. Now, have you solved the problem? No. Does it make any difference if you just lower the pressure in terms of overall health? In my mind, the answer is no. Because whatever's wrong that may be causing you to add hypertension as one of the symptoms, the other stuff, the problem is still going on, and it could express other ways. So you still are in trouble health-wise. And that's what we want to solve. We want to solve the problem so the hypertension is not a necessary issue. Now, it's strange about hypertension. I mentioned what the old numbers used to be, about 75 to 85, and 100 plus your age for the upper number. So that means if you're 90 years old, your upper number would be 190. And that would be quite interesting in terms of today. But it wouldn't be so likely to happen, because the other number has to do with tension on the left ventricle of the heart. And when somebody's 90 years old, it's probably beginning to weaken a little bit in most cases. So that it would not likely happen, but theoretically under those guidelines it could. But we're talking now guidelines that came out of regular medicine. And of course they keep changing, and as I say, medicine more often than not today treats numbers, not people. And if they can get the numbers right, it doesn't make any difference if the person is sicker than ever. If the numbers are right, then they're done. And I don't know how many people I've had come in my office, and they would say, well, I went to the doctor and they did all this blood tests, and everything's fine. but they might have to be carried into my office, but yet all the numbers were okay. So balancing numbers does not mean that you have made someone well or better. It only means that you've in some way manipulated the numbers. But in my mind, there's a long way away from solving the problem if you just force the number. You know, it's almost like, you know, your speedometer is reading 80 and you say, wow, that's too high. Let's put a pin on the speedometer that won't allow it to go above 60. Well, we really haven't solved the problem. We're still going too fast and we could get in trouble. Okay, so the physiology of the body is that the brain nervous system is the big player as far as the regulation of all the functions of the body. Most of the functions involve some type of signals, neurologically or hormonal or both, that tell everything what to do. Within the center of the brain, there is the thalamus, which is the unconscious regulator of everything. In other words, you don't have to think about it. It's doing all this stuff automatically. And then below the thalamus, you have the hypothalamus. The hypothalamus is a smaller portion that is constantly reading the blood. And when it reads the blood, it picks up signals about hormone levels and various things going on that have been released into the blood as indicators of some adjustment change being needed. So, if, for example, if your thyroid is hypoproductive of T4, when the blood circulates through the hypothalamus, it picks up the level of T4 as being low. Okay, so now a corrective action, readjustment is needed, so it sends a signal to the pituitary to release TSH, which is thyroid stimulating hormone, which is another signal that goes down to the thyroid and says, hey, put out some more T4. Now, if the thyroid is capable of doing that, it will. So, on the other hand, if it gets too high, the hypothalamus picks up that there's too much, and so it now shuts off the signal to the pituitary to release TSH, so that you stop producing any more T4 until the level comes down. So it's like a thermostat regulating too much or too little and keeping it within a certain boundary. Now, if something interrupts all of that, then you've got trouble. But basically, that is one of the big regulators, is the hypothalamus in the brain, as I call it, kind of like a microprocessor that works through the pituitary to send out these messages to the adrenals, the thyroid, the thymus, the pancreas, and so forth, the testicles, ovaries, or whatever information needs to be, or to the kidneys, for example, antidiuretic hormone to cut off dropping out too much water if you are losing too much water. So it just depends on what is picked up by the hypothalamus. So that's the first part. Now there are sensors that go out through the body via the autonomic nervous system that pick up information that tells the body whether you're too hot or you're too cold, or that you're too much this or too much that. And so that feedback all goes back and in turn causes release of signals to do certain things in the body. And so that's how everything is maintained in a balanced state. Now, certain organs interact with the autonomic system and with all of this messaging to regulate things. Now, some signals can come from the conscious thought. For example, if you think somebody's going to punch you, that thought triggers a whole set of responses to create a defensive maneuver. So that one is more conscious, but there are automatic ones, like if you put your finger on a hot stove, before you think, should I or should I not take that finger off that hot stove, a reflex goes and causes a muscle contraction and pulls your hand away. Faster almost than you can think of it, if not faster. And so those are automatic. And so all these different functions have sympathetic and parasympathetic. Now, a long time ago, it was discovered that the sympathetic revs up certain things, and the parasympathetic shuts down or slows down certain things. And so it's a balance between that keeps everything going. There's a lot of other sensors that feed back information that most of it is beyond our conscious thought. For example, there is something, a group of things called the tactile, meaning touch or something touching you, vestibular, having to do with the inner ear and balance, and proprioceptor nervous system, which connects to the connective tissue related to muscles and so forth, that feed all the information back to a part of the brain that automatically keeps you balanced, lets you know that you're head up instead of head down, and all those things that are necessary for you to automatically adjust your gait and your balance and whatever to maintain some state of equilibrium. And so that's automatically being fed back in the background. You don't have to think about it. It just, those signals are going in automatically, being picked up. And so those all work together, and as I say, more often than not, hormones or some other biochemic, such as a neuropeptide or neurotransmitters or whatever, depending on what happened, are released based on all these signals that are coming in. And so it's important to understand that this, a good share of it's all automatic, and that's part of the problem sometimes, because if we affect that system by feeding either false information in and or chemicals that overstimulate it and or some kind of chemical or toxin that inhibits, we interfere with that balance system. And so it was learned a long time ago that the body always tends to want to put itself into a state of balance or equilibrium, and to respond when necessary to an emergency. And so when that happens, that something confronts us suddenly, that triggers a whole set of responses in our body, changing blood pressure, blood flow, heart rate, respiration rate, all those things, and shutting down the bowel tract and whatever. All those things happen very rapidly whenever we're confronted with something. But if we get a false signal, we can still get the same response. In other words, if you imagine that somebody's standing behind you with a large knife and they're ready to stab you, whether they're there or not, you can trigger the same set of responses as though they were to jump out of the way or whatever is required, because that information is what causes something to happen. And so that's going on all the time. Now, some of the various what I want to say, sensors that are scattered throughout the body pick up information and send back to keep things going also, and in particular with the heart and circulatory system. Now, within the vascular system, the arteries, there's a set of sensors on the carotids going into the head and brain that are called chemosensors, that are all the time sensing the blood for the amount of oxygen. Now, the brain can't function very long with no oxygen. Needs fuel and it needs oxygen to work right. Okay, so if the oxygen level going into the brain is dropped, it could mean two things. Either there's a loss of circulation to the head and brain, like your throat was cut, or it could mean that you're not being able to take in and absorb oxygen, or whatever. There's a series of things that could be going on. Well, at any rate, the brain, this built-in system, knows that if you don't get enough oxygen to the brain, you're going to probably pass out. So what does it do? It immediately sends a signal to the heart to start beating faster, moving more blood at a faster rate. And so that's called a chronotropic response, meaning it changes the speed of the heartbeat. On the other hand, within the renal artery going into the kidneys, there is a sensor called a barosensor or a pressure sensor. So, again, these are all automatic systems built into the body. So, if for some reason the amount of blood coming into the kidneys from the renal artery is down, the pressure's down, there is a protective system, again, that's built into us that says if there's not very much blood or not enough blood coming into the kidney, it may mean that something is wrong and we're losing blood someplace. So guess what we need to do? Squeeze the arteries closed or very small so that if you are injured and are leaking out blood, you reduce the amount of blood being lost until the clotting mechanism can take over and stop the blood loss. So those are protective mechanisms. But suppose that at the junction going into the renal organ, the kidney, there is some kind of blockage, i.e. plaquing or some kind of obstruction, and it reduces the amount going in. Guess what? A false signal goes to the homeostatic control centers in the brain, and it clamps down on the arteries, and of course the pressure goes up. So that then can cause hypertension if something is interfering with the blood flow to the artery of the kidneys. And it's interesting, do a lot of things. You know, there's a lot of dual purpose in all the organs. It's never that simple. It so happens that the kidneys also sense the amount of red cells in the blood. And if the number are going down, it sends out a hormone called erythropoietin and tells the body to build more red cells. There's a shortage of red cells in the blood because not enough red cells, you can't carry enough oxygen. You can't carry enough oxygen, you can be in trouble. So, false signals of some sort, for example with the pressure, can actually cause the blood pressure to raise because of the fact that the signal said you might be losing blood, so we've got to contract those vessels to keep the blood loss at a minimum. So it's fascinating when you get into the body and you begin to understand how the whole thing works, how it all makes sense. But at the same time, it gives you a rationale for how to look for the cause of a program, as opposed to just giving you a drug that interferes with the signals going to the arteries. Because with every drug, synthetic in particular, there is a certain set of what they call side effects, which I call adverse effects. It's more than a side effect, it's a major effect. And many of those adverse effects are death. And so the question is, are you helping more people by taking the drug and getting a better number? Or actually, in the long run, are you damaging and destroying more people, i.e. destroying kidneys, and there's a bunch of things can happen. Are you actually creating more problems which have to be, quote, treated with more drugs and or impairment or death? And so that's kind of, in a nutshell, without getting too too heavily into the physiology, but to kind of give you enough of an understanding what we're dealing with. So what we're dealing with is something that is disrupting the regulatory system, and there's different things that can do that. And so in our next broadcast, so that you'll have time to digest some of the stuff I've given you today, well, it's interesting to see how it all comes together and plays out. And so then we'll be asking the question, are we helping more people, or actually are we damaging and destroying more people? I think I'm going to close with something I ran into. This is going to be your homework. This supposedly is serious, but see what you can find out about it. It just came across to me just in the last day or so. It says FDA recommends at least 3 servings of foods with word fruit on box. It sounds so ridiculous that you would have to think it must be a joke, but I'm not so sure that it is. Silver Springs, Maryland. In an effort to get Americans to at least go through the motions of a healthier diet, the Food and Drug Administration announced Wednesday it is now recommending individuals consume 3 servings of foods every day that simply include the word fruit on the box. Though we have in the past advised eating a minimum of 3 pieces of actual fruit per day, it is now acceptable to eat any food labeled with the word fruit. Variations such as fruity, fruitalicious, or fruit blasted. FDA Commissioner Margaret Hamburg told the reporters, also noting that sweetened cereal or gummies shaped like fruit are entirely permissible under the agency's new guidelines. If it smells somewhat like fruit, or even if there's a cartoon strawberry or orange on the wrapper, that's sufficient at this point. The FDA's new recommendations are expected to be followed by other guidelines under which anything successfully chewed and swallowed can now be considered a vegetable. See what you can find out about it. It was nice being with you again. Don't forget to go to our website, mindyourhealthcast.com, and come back again for our next part 2 of hypertension. Until then, be healthy.